Morning. This is a video presentation on hormone replacement for breast cancer survivors, part two. This talk comes from chapter 19 of my new book, Bioidentical Hormones 101, second edition, which is available on Amazon as an ebook 3-volume set. Each volume currently is 99 cents. So please take advantage of the reduced pricing. Paperback will be available hopefully soon, and we'll make the paperback available in about 4 weeks or so. This is the cover of the ebook. It's a 3-volume set, 99 cents for each volume. We're going to talk about breast cancer survivors and ask the question, should they be taking hormone replacement, yes or no? Current thinking, mainstream medicine thinking, is hormone replacement is contraindicated in breast cancer survivors because of risk of breast cancer recurrence. Is that really true? Let's ask that question. First question is, well, how many breast cancer survivors are there in the United States? And we estimate there's currently around 400,000 breast cancer survivors in the United States using hormone replacement. Out of 4 million survivors, 10% are using hormone replacement, or about 400,000. That's a lot of women, breast cancer survivors using hormone replacement. So over time, there have been studies of women on hormone replacement, breast cancer survivors on hormone replacement, and thanks and credit goes to Dr. Avram Bluming, who's the author of Estrogen Matters, who compiled 26 of these studies of hormone replacement of breast cancer survivors. 25 out of 26 showed no increased recurrence in the hormone-treated group. The one study that did show increased recurrence was the HABIT study by Lars Holmberg from Sweden. They used estrogen with a synthetic progestin called norethisterone, which is used in Scandinavia, not used in the United States very much. And all of the patients who had a recurrence in the HABITS trial were also taking tamoxifen, which is a commonly used estrogen receptor blocker drug. It's commonly used for breast cancer survivors. The idea being by blocking estrogen receptors, we can prevent breast cancer recurrence. In this case, it did the exact opposite. The tamoxifen treated patients had a 300% increase in breast cancer recurrence. The trial was terminated early after only 2 years of follow-up because of this 300% increase in breast cancer in the hormone-treated group. There are a few other facts about the HABITS trial, which Dr. Bluming brought out. And let's ask a couple of questions about some of these things. There was no increase among women randomized to estrogen alone. Why was that the case? We're going to try to answer that. There was no increase when Premarin was used as the estrogen, as the source of estrogen. Why was that true? The 300%, and again, this massive 300% increase was only among women who were also taking tamoxifen in conjunction with the hormone replacement. We're going to delve into that and answer the question of why that happened. A few other things to bring out was that tamoxifen blocks ER alpha, does not block ER beta. Just to go back a little bit, there are two estrogen receptors, alpha and beta. The alpha receptor is proliferative. The beta receptor is breast cancer preventive, is tumor suppressor. This is a tumor suppressor, ER beta. Premarin activates ER beta preferentially. So while tamoxifen is blocking ER alpha, Premarin can still activate ER beta. And perhaps this explains why in the HABITS study, the patients on Premarin had no recurrence despite taking the synthetic progestin, norethisterone. And a couple of supportive studies, one by Dach in 2022 showed that tamoxifen targets ER beta to kill lymphoma cells in vitro. Study in 2025 by Dr. Dach, working with breast cancer cells, showed that tamoxifen enhanced ER beta levels and had an anti-proliferative effect on ER beta mutant P53 breast cancer cells. Okay, in reviewing the 26 studies compiled by Dr. Blooming, showing 25 out of 26 showing no increased recurrence in breast cancer survivors on hormone replacement. Let's go through those studies in more detail. Which of the 26 studies had the best outcomes? And we already looked at the habit study, which had the worst outcome. Which of the 26 had the best outcomes? Well, we have to ask the question, does the hormone replacement program formula contain testosterone? One study in 1999 by Dr. Natrajan from Augusta, Georgia, used testosterone pellets in 38 of 50 patients, breast cancer survivor patients on hormone replacement. Amazingly, there was an 81% reduction in mortality in the hormone replacement users compared to non-users. So we have to seriously think about adding testosterone to all of our formulas because of its breast cancer preventive qualities. The two big studies I should mention here, which showed testosterone as breast cancer preventive. One was done by Rebecca Glazer, a breast cancer surgeon in Dayton, Ohio, who's been using testosterone pellets for 25 years now, and publishes all of her data. Her data showed testosterone pellet menopausal women had a 40% reduction in breast cancer compared to the general population. And she also did a study in breast cancer survivors showing very good results with the testosterone pellets. A second study was done by Dr. Gary Donovitz, also showing a 35 to 40% reduction in breast cancer in menopausal women using hormone testosterone pellets. Let's stop here, and we're going to continue in a few minutes after a brief pause.